Hello, everyone. I'm Stacy Fox with the Open Minds Market Intelligence team, and I'd like to welcome you to today's Circle Elite Executive Roundtable, Selling the Next Normal, How to Improve Consumer Engagement in Telehealth Services, featuring Amanda Jernigan, LCSW, Corporate Director of Outpatient Services for Gaudenzia. Moderating today's session is Open Minds Senior Associate Erin Pressel. Amanda has been working in the field since 1999 in a variety of settings, including children and youth, inpatient psychiatric facilities, and drug and alcohol. Amanda has passion for trainings and does them throughout Pennsylvania for various organizations and at conferences, and she's been an adjunct professor at Penn State Harrisburg since 2013. Erin is an experienced executive with an expansive history in the human services industry, focused on marketing and communications, referral development and management, business development and implementation of growth strategies, and strategic planning. Before we get started, just a few housekeeping reminders. Your audio is muted during today's presentation. However, we encourage you to submit any questions you have using the question box on the right side of your screen. We will present them at the end. The slides and recording from today's briefing will be available on the Open Minds website tomorrow. Erin, I'll turn it over to you.
Great. Thanks so much, Stacy, and thanks, Amanda, for joining us to talk a little bit about telehealth and Gaudenzia and kind of how everything's working, what's been successful, what challenges that you've had. I'm just going to go to the agenda here. So for today, these are the things that we're going to go over: communication and information for consumers to access telehealth services. How are we communicating the right topics to them? How are we communicating to them how to be successful in their treatment? Developing strategies for effective consumer engagement. So how are we putting together strategies to make sure that consumers are being successful at telehealth services rather than in-person services? What kind of things are we using? How are we using the platforms? How are we setting up the groups? Necessary education for the next normal, measuring data on growth and ROI for both the provider and the consumer, challenges experienced by the consumer and provider organizations, and what are our recommendations to make sure that we implement good services for consumers and that we are successful at doing that. So first, before we start with the communication and information for consumers to access telehealth services, could you give me a little bit of background on Gaudenzia and how you've pivoted during COVID into telehealth services and what that looked like?
So I will say that initially it happened rather quickly. So we had to do the best we could in a short amount of time. We quickly created Zoom links for all of our offices, for all of our groups when COVID first hit and everything was shut down. So there was not a break in services for the clients. We've had to make adjustments. Now we offer things like hybrid groups where we have some people attending in person while there's a television in the group room with a camera, and some people attend at that same time via Zoom. So we're able to keep distance, healthy distance with people. We're able to meet those COVID quarantine restrictions, childcare restrictions. So it's really grown and changed, and it's been great and successful because we've been able to be flexible and meet clients where they're at and what their needs are at the time.
That's great. And what challenges have the consumers had in participating in telehealth services? Has there been any feedback from them, or how does that look for them?
I think initially some of the bigger obstacles and hurdles we've had to overcome came from, we have sites all across Pennsylvania, Maryland, Delaware, and Washington, D.C. So different clients have different needs, but clients who had government issued phones did not have the amount of minutes to participate in IOP that we would want them to participate in. So we've had to be creative with them. We've had to create spots where they could come in and use internet if they didn't have internet access for services. You know, we've tried to meet clients exactly where their biggest issues are. I think other things that came up is with the shortages in the job market is the amount of time people have to work. So offering more options for treatment. So if you're working day shift today and night shift tomorrow, you're able to attend a day group that day of your night shift and you're not missing groups. So being flexible with them.
Great. Thanks for the background.
Sure.
So let's talk a little bit about communication. And excuse me for a second, I'm having a little technical difficulty here. Okay. Just moving my windows around here. So with the provision of platforms, meaning what kind of technology is actually being utilized, and what kind of services can be offered through different platforms virtually. How did you choose a platform to use? I mean, what did that process look like for Gaudensia?
So initially when the pandemic first hit, everyone was using Zoom because that was what everyone knew or go-to meeting. What we found was Zoom had the best links. We were able to get the medical version of Zoom, which gave us protection via HIPAA for privacy and things of that nature, kept the Zoom bombers out. We did try some other platforms that weren't as successful with connectivity issues, audio, sound, and quality. Zoom's been the most consistent platform that we've found.
Great. And are you able to provide, outpatient and IOP services through telehealth? Are you providing any other services right now, or?
We provide groups and individual sessions as well, and family sessions.
Okay. Great. And one of the things that you spoke about just a couple minutes ago is with the access to mobile devices, and I guess access to the actual minutes. So what about people that don't have mobile phones? Are they just required then to come into the office, or are they given resources to maybe be able to obtain some kind of device?
So what we've been doing is there is still the ability to use telephonic services if we can prove that there's a need. So if we know that somebody doesn't have the ability to use like a video screen and we document that and assess that and they're appropriate for telehealth services, we are able to do telephonic services with them.
Oh, great. Thank you for that. I was not aware.
Yeah.
And with the training of both the provider and the consumer, has that been pretty easy? Do you feel like people are pretty familiar with the Zoom platform and they're able to access it easily, or do you have to provide certain tips, instructions, depending on the consumer or the clinician?
Overall, most people are fairly familiar with Zoom. It's a similar platform that all the schools used when COVID first hit and schools went online. But for those that struggle, we're able to speak with them via phone, walk them through the process the first time, and once they're on, switch back over to the video capabilities and help them get on. But for the most part, we haven't seen that there's been any big issues other than the very few times throughout the year where there's been internet outages, like across the board, like Comcast, Verizon outages. There's not much we're going to be able to do about that, but you know, we're able to make adjustments on the fly if we need to.
And what happens when that occurs? Like if there's an outage, say during a group or anything, how does that look in terms of, you know, client attendance or billing or anything like that? Do you have to reschedule the group, or?
So usually if it's something long-term, we know ahead of time, so we can notify them ahead of time to make it an alternate date. So like the Verizon outage was like an all-day thing. So we knew at like 9 a.m. there was going to be a problem. We were able to get in touch with people ahead of time. One thing that we do is we take attendance several times throughout the group process to make sure everybody's still there. So if somebody is missing, we will follow up with them immediately after group. If it's somebody who no-showed for the entire group, we make contact within 24 hours to see what's going on and to check in with them.
Okay, great. All right. So when you're communicating about the services that you're providing at Gaudensia, and you're talking to, maybe, you know, you want to make sure that your consumers know what is offered when, what the schedule looks like, certain marketing almost techniques about, you know, what you can provide. What is the best way to do this? Are you doing this? And these are the avenues of communication that we kind of listed: website, social media, through your app if you have one, emails, phones. Do you keep in touch with people through emails? How do you advertise the services or let them know what's available?
So we use everything that you've listed there. In addition, we also have mesmerized televisions on site. So if somebody's sitting in the lobby waiting for an appointment, they're scrolling advertisements of services that we offer. We also use something called campaigns through a company called MeU, where we send out reminders to clients with their next group times, so they know what the group schedules are.
Great.
There's text messages that they get.
And what about, like, you said that you also offer family groups and family services. Are they something that you promote to maybe some of the consumers that are already attending services, or how do they find out about, you know, some of the different stuff that you provide that way?
Part of our assessment process is we ask them if they'd like family sessions, and if they would, we set them up with that from the beginning. For those who decline them initially, we continue to ask throughout sessions if that's something they change their mind about and they'd like to continue. We strongly encourage that they have at least one family session prior to leaving with someone. If it's not a family member, a friend, who will be their support upon leaving treatment. So.
Okay. And family services, we know, are so important to
Absolutely.
the success of clients. Okay, so developing strategies for effective consumer engagement. What are some of the things that have been done? So consistent training of staff on techniques of virtual and individual group sessions. How have you made sure that your clinical staff is trained, or what kind of strategies do you use to make sure that they are able to engage the consumers and provide good services this way? Because it is a pivot from the in-person services. When you're not face-to-face with somebody, things are very, very different.
Absolutely. And some of the staff really excelled at it. Some of the staff did not care for it much at all. So we've kind of been highlighting those that find it very beneficial, that find it to be engaging, that enjoy it, and those are who we focus on. But we do require them all to take an engagement training, which teaches them how to use the Zoom platform, as well as ideas on how to engage telehealth groups, whether that's a full-on telehealth group or a hybrid group, you know, providing educations, providing activities for them to do. We have curriculums on a shared drive where everyone can go in and pull things from, encouraging them to give homework assignments and spending time reviewing that. You know, is just because you're not physically there, you run the group the same way you would when we were in person, and we try to figure out ways to make that happen so it's a seamless transition for those coming back into the physical setting if that's what they choose to do.
Great. And what about do you gather feedback from them? So surveying and asking for feedback in order to make necessary improvements. Do you ask for feedback from your clients? And what does that look like? And what kind of feedback are you getting? Are they pleased with services, or are you able to look at what feedback that they give you and kind of make improvements based on that?
So we do provide, we have added telehealth questions to our yearly surveys that we provide through all of our clients. So that's something that's a CARF accreditation, but we've added a whole section related to telehealth. If they use them, did they enjoy them? Did they find them helpful? And we've found that almost everyone that's engaged in it has found it extremely helpful. It's been one more thing they didn't have to worry about when schools were closing every other day, when their babysitter was sick, when their job schedule changed. They just found it to be frequent. Our attendance rates were much better for people on telehealth. The productivity of the clinicians of how their kept sessions was higher. It just has been amazing. We're gearing up for potentially a really big snowstorm Sunday into Monday, which again is a great way and a great thing to have telehealth. So we won't have services interrupted Tuesday
Right.
if you can't get out of your parking spot, or there's no public transportation in the city because there's nowhere to put the snow or whatever. So encouraging our staff to use it that way as well. And also using it as an incentive for staff, as a way to say, like, if you want to work and it's snowing, here's a way to do it without having to take a day off of work. So
Yeah, that's a great incentive. And also, I know with Gaudensia, you have a lot of offices and locations that are in rural areas.
absolutely.
And a lot of the struggle for some of the consumers is transportation, getting back and forth to the office, because sometimes it can be very, very far. So I'm sure that telehealth helps in that way as well.
Absolutely, and especially when there's inclement weather or bus driver shortages where the bus schedules are shortened, people can't get into treatment, and this is an opportunity for them to get to treatment. What we've also found is there's a lot more flexibility. We offer day groups and evening groups, and with telehealth, people can pick different groups where they were so much more limited before with when they could get a ride. So
Right.
they fit what fits their schedule a lot better, which is great.
Yeah, that is a really good point. So for example, if they wanted to attend a certain group at 9:00 a.m. and before maybe the bus couldn't get there at that time, or now they can sit home and actually attend that group.
Absolutely, and they don't have to change their work schedule or their babysitter schedule or whatever.
That's amazing. So how do we measure data on growth and return on investment for both the provider and the consumer? So if we look at some of the stats that are going on now, behavioral health televisits have increased 6,500% during the COVID-19 public health emergency, even though the actual number of mental health claims overall just increased slightly. And if you look at the numbers, it's just kind of amazing to see a little bit about the diagnosis and the consumers based in January 2020 to February 2021, and the actual telehealth services that were provided. It's a big, big difference. So it's a good opportunity for a lot of providers to really take a look at how they can propel their services now, how they can expand them, how they can improve them and sustain them, because they're going to be around for a long time. And I think that, Amanda, you would agree.
Mental health services have been doing telehealth for far, far longer than drug and alcohol services. So, the fact that we have an opportunity to do this in substance abuse is huge. And to prove it's beneficial so they keep it going is even more important, in my opinion.
Right. And so if you look at some of the opportunities to exist and strengthen the evaluation and oversight of telehealth for behavioral health and Medicaid, they determined that there have only been 2 states that have actually completed evaluations of the effects of telehealth on behavioral health services. Some states couldn't identify services being provided under telehealth, and many states do not conduct monitoring and oversight specific to telehealth, even though there are concerns about waste, fraud, and abuse. So the National Quality Forum recommends measuring telehealth quality in 4 areas of impact. And these are some of the things that we spoke about. Consumer access to care. What are the financial impacts to consumers and their care team? What does that look like? Experience of the consumer and the clinical professional, and effectiveness of clinical and operation systems. Within each of these 4 areas of impact, telehealth quality can be assessed based on the following factors. This is one of the things we talked about, the degree of change in travel time for consumers or clinical professionals. So Amanda, you spoke about, kind of the incentive for some of the clinical professionals to be able to provide services from home. And also with consumers, a lot of the times when they're in rural areas, or if they have some challenges with childcare or work or anything, they're able to limit their travel time. Improvements in the timeliness of care. So can you talk a little bit about how, I know that there was for a long time a big wait time to get people into services. Has that changed with telehealth? Are you able to get people into treatment quicker?
I think that we are able in some of our offices to get them in much quicker. Other offices are still high volume, so it does take a little bit of time. But I think the other part that we're able to do as well is that we see a big difference in is the show rate. So a lot of times when in-person assessments are scheduled, they tend to no show, whereas if they're telehealth assessments, they almost always show. I think that's a big piece as far as the timeliness of care. Instead of having to spend time following that individual and rescheduling them, they tend to keep that first appointment, which gets them into treatment faster.
Great. There's been improvement based on in obtaining and sharing actionable information, improvement in the use of evidence-based practices, a change in consumer empowerment. So I wanted to talk about that a little bit with you. With telehealth services, a lot of things that we've been seeing with providers are that they've been expanding access to consumers with their records, with access to kind of their treatment plans virtually. Is that happening with Gaudentia, or are you seeing that with other providers? And what are consumers thinking about that?
So when we
like
do
patient portal.
Yeah, so we don't have specific patient portals at this time, but we are able to share documents as we're completing assessments. So showing them things that we're doing, we're able to use DocuSign as a way to get them their documents. So they have copies of documents, can sign things and send them back. And I think that the empowerment piece also comes from the fact that the client feels like they have some say in their treatment as far as the form of which it's going to be delivered. So I think that's another empowerment piece. It's not just access to records, but the ability to say, hey, this week I like to come in person, and then wake up on Monday and have a sick kid, and then all of a sudden want to go virtual the next week, and we can make that happen. And that empowers them to want to continue to care for themselves while still being an important part to their family.
Now, let me ask a question about that too. So, you provide the hybrid services, but if something like that happens, how does that get communicated from the consumer to you?
So usually they either call the front office and say, hey, I can't come in tonight, I'm going to be attending via Zoom, or send an email to the counselor or call the counselor. Or when they come in for treatment, we provide them both the times of in-person, and we also provide them the Zoom link so they can access it either way. So let's say they're on their way to group and they get a flat tire, they'll have the Zoom link and we'll be able to Zoom in while they wait for AAA, I guess. It's not too cold.
Say that. They can sit in the car with their coat on and wait
for a little chilly
right
now. Yeah.
But also that, I guess that can be a plus and a minus depending, for the consumer, because before maybe they would have been like, oh, you know, I got a flat tire, I can't come in. Now there's not a lot of leeway there, right? They're kind of
Mhm.
expected to be there.
And
Yeah.
I think that,
Okay.
you know,
So
probation
then,
and places like that expect that as well, is you have the opportunity and the option. There's no reason you can't attend, so.
right. And I wonder how that's also kind of affecting some of the specialty courts
Mhm.
too. Because I know that there used to be a lot of struggle with that, you know, getting to treatment and everything. So I'm sure that it's improving the success in some of the specialty courts, like the drug courts and mental health courts.
Probably, and I know a lot of them just went back to in-person court either this month or the end of last month, so they've been
Oh,
doing
wow. Okay.
Zoom court, yeah.
Zoom court.
I guess that's
That's
what you
really
call it.
interesting too.
Yeah.
Yeah. So, and we just spoke about this. I mean, there's been improvements in care coordination then between clinical professionals and provider coordination or
Yep.
provider organization. Sorry. So when you're putting together some of the telehealth services, here's just a checklist that you can kind of look at and go over, you know, are you putting everything in place? And Amanda, there may be some of this that you want to talk about or add to. So determining the current fit within the agency, making sure that you're reviewing your strategic priorities and strategic plan, reviewing your current and proposed services that are provided. So are you adding services? Are you getting rid of some services depending? Securing your board input and feedback. Are they aware of this? What do they think about the services? Identifying leaders. So gauging staff interest and expertise. One of the things that you mentioned is that some of the clinicians are really good at it and some are not, and some want to do it and some don't. Contacting the State Primary Care Association. Finding mentors. Who is doing this well? You might want to reach out to potential mentors that you know are doing this well, determining their parameters, engaging and learning from them. Assessing interest, readiness, and potential scalability. So identifying current activities, starting where the interest and expertise is highest, determining the need, assessing your partner's readiness, determining funding and reimbursement resources. And I think that that's a really big one for everybody. So what is revenue going to look like? And I know that like for Medicaid, they've been, expanding the opportunity for reimbursement through telehealth services. And I'm not sure, I know that it had expanded through COVID-19, but I'm not sure what it is now. Amanda, do you have any feedback on that?
I know that they have started to create separate modifiers to code telehealth services for certain payers. So before it was just listed as an individual service or a group service, now we have to separate them out. But it's not across the board, it's only by funder. So.
Okay. And so reviewing laws, licensing, liability, and regulations. One of the things that you and I spoke about too before this call was like cross-state licensing and how does that look, because Gaudentia has programs in 3 states and Washington, D.C. And are you able to go across states and provide these services? And I guess right now, in terms of, getting reimbursement, the answer is pretty much no. Is that correct?
Yeah, you have to be licensed in each of the states. There was an emergency declaration that ended.
Okay.
I don't know which time. It seems like there's new emergency declaration all the time, but one of them ended that. we can do it in Pennsylvania, but it doesn't mean the other states have to accept it. So that's kind of where we're at right now.
Okay, great. And summarizing the potential outcomes. So identifying what benefits may result in terms of service operations, client benefits, identifying what potential challenges that you may have, and conducting a cost benefit analysis. So what does it look like? Because previously, I mean, it was, you had to have physical plants to provide services, right? When there wasn't a lot of, there wasn't like reimbursement available or anything. So people would have to actually come to the provider, sit there, do a face-to-face service. And now a lot of providers are actually closing some of their physical plants because they don't really need them.
Mm-hmm.
Is that correct?
Yeah, I mean, you can definitely save money on rent and electricity and heat and all the stuff that runs an office if you can operate telehealth. Considering a branch of telehealth that might be a separate entity from other streams of business, and
Amanda,
just
can you hear me?
Yeah, I can hear you. Can you hear me? Oh.
Yeah, I think that I lost internet for a second.
But I think considering it as another line of business where you could hire staff and have pretty much all overhead or mostly overhead because you're not having a physical plant that just do that service makes good sense. So.
Right. Okay. So let's look at some of the challenges that have been experienced by consumers and provider organizations. And some of these things we already talked about. So challenges for consumers: school access, daycare access, work schedules, transportation.
I would also say medical conditions. So some people have medical conditions where they don't want to be around a lot of other people. They're high risk. So I think another challenge is also medical conditions. And that's something that we can help with telehealth. So.
And then we talked too about when you're providing the hybrid services, development of the hybrid services also assists with quarantine. So for example, maybe you have, an adult is exposed to COVID-19 and usually attends all of their services in person. Now they can actually attend them through telehealth and not miss anything during their quarantine. Whereas before they may have had to stay home for 14 days and not experience any services. And that could really have a big impact on their journey to recovery.
Absolutely. And I think the idea of social isolation has affected a lot of people during COVID. And this way you still get human interaction through that hybrid system. So it helps with the depression and the anxiety and all the other stuff that goes along with social isolation.
And one of the things that that we talked about previously is adolescents and how this looks for them. Can you kind of go over what kind of programming that you have for adolescents now, what that looks like, how that's been successful?
Absolutely. So for adolescents, a lot of them are attending school. A lot of them obviously rely on adults to get them to and from treatment. So we're able to do Zoom sessions with them. If they have a parent who works to 6, 7, 8 o'clock at night, we're able to see them right after school. We've been able to work with like placements. So if an adolescent is discharging from, let's say, a secure detention facility, we're able to do their assessment ahead of time. So by the time they get home, they've already been assessed and can start services immediately without having to wait for an appointment date. We have contracts through the local SCA here where we go into the detention facility locally and do their assessments, and we provide treatment for them while they're in the detention facility. And with COVID and the quarantines, we've been able to provide those services and continue to provide those services remotely. With schools being shut down, we have SAP contracts. We can't get into the schools a lot, or they're not letting like what they consider outside visitors in. So we're able to continue SAP services as well through telehealth, which has been amazing. So adolescents really haven't missed a beat with services. So.
And can you explain SAP services for anybody that doesn't know what they are?
So these are, each school district has a student assistance program where teachers, guidance counselors, coaches, anyone can refer anyone who has concerns about them for mental health or drug or alcohol concerns. The SAP team will put together a referral. They'll send it to the county in Dauphin County, who does a quick like screening. And if they meet the criteria, they get pulled. We get the referral to do a full-on assessment of each student.
Right. Yeah, I was wondering that too. So with the detention facilities and with the schools, all of those services, all of those assessments and services are through telehealth now?
So some of the schools will let you in, some of the schools are not letting outside visitors in. It's kind of like as it goes. And, you know, like the other day, you wake up and there's a school district that's closed for COVID concerns, and you had 5 kids you had planned to go see that day. All I had to do was switch everything to telehealth. So they didn't miss a session.
That's great.
Mm-hmm.
So with the telehealth services, are you seeing, you know, in your organization, are you seeing increases in revenue due to more people attending?
Yeah, I think that we're definitely seeing group sizes grow. We're definitely seeing more kept appointments and less no-shows, you know, in assessments and individual sessions as well. We give, you know, we give the clients the ability to log on, and if they don't log on, we call to see where they are, and we gently encourage them to log on, so maybe they forgot, and we're able to capture them that way as well. So it's just been overall, we've seen a definite increase, and people are appreciative that we offer all these things, and collateral resources are appreciative that we offer telehealth as well.
I bet it's helping you build a lot of relationships. And
Absolutely.
with the licensing and the staff to client ratio requirements, how does that look?
It's still the same as it would be in-person services. That has not changed. So
okay,
the same information is required. The only thing in addition that we do is each time we do a treatment plan, we do what's called a telehealth assessment, and that's to make sure somebody's still appropriate for telehealth. So we make sure they're not suicidal. We make sure they haven't had a recent relapse. We make sure they still have access to, you know, privacy and internet, and, you know, they're not having hallucinations or anything that would prevent them from being telehealth appropriate.
Okay. So with provider organizations, there have been some specific challenges, engagement with consumers, particularly in larger groups. What kind of strategies are you using to keep consumers engaged during longer groups, say, you know, an IOP group, for example?
So we kind of created what we call an IOP schedule. So we have a schedule of the night and what it should look like based on periods of time. So we post that and clients know ahead of time what to anticipate. So that seems to help things as well. We break it up with not only having conversation and discussion, but we also do activities to engage clients. We kind of poll the clients to see what they would like to do sometimes, and we incorporate that into our education for the evening and our group for the evening. We give them homework assignments, which we spend time reviewing. We do things like check-ins. That gets people engaged and involved. You know, how are they doing? When was the last time they used? What's something that's great about their week? What's something that's not so great about their week? And we have that to start a discussion about. And we take attendance multiple times throughout the night, like I said, to make sure that people don't disappear throughout that period of time. So usually in the beginning, middle, and end. And nobody knows when it's coming. It's like surprise attendance. So.
And with monitoring their attendance and participation, we just talked about that, like, surprise, are you there?
Yeah, and if I'm running the group and it's not my client that's attending the group and they didn't participate, the expectation is that the staff member reaches out to that clinician and lets them know, hey, Joe wasn't very talkative tonight. You know, it didn't seem like he was very engaged. And then when that person meets with their primary counselor the next time, they can have a discussion.
Okay, great. And then with the staff training, how do you, are there specific training opportunities available for staff to be able to learn how to provide these services virtually?
So we provide monthly training that repeat each month for staff. That way, if we have new staff coming or staff that need a refresher, they can sign up. So this is one of the offerings each month that people can sign up for. So
Oh, great.
mhm.
Okay. And that's very necessary. I mean,
Absolutely.
because it is very different. Okay. So let's talk about what now. What kind of recommendations can we make for people to be able to provide really good telehealth services that are helping their consumers get well, that engage their consumers and, provide them with everything that they need to be successful. So hybrid programs for sure, develop high value hybrid programs for specific consumer groups, combining in-office, home-based, and virtual care in a way that optimizes consumer experience and decreases service costs. And we talked a little bit about that. So, we may not have to have a physical plant, as a provider agency in order to provide these services. Also with staffing, if you're in the same state and you're licensed and you're in one area of the state, you may be able to provide services.
I also would say too, try to anticipate as much as you can, like days that your office would be closed, whether that's for weather or something else. Like I used to live in Cooperstown, New York, and I remember that when there was Baseball Hall of Fame inductions, like the whole world would shut down and you would miss an entire day of services. So like using virtual to stop those, those lost days is going to increase your revenue overall. So if you can
Right.
anticipate that and plan ahead of time, you can turn a potential lost revenue day into a productive day, if that makes sense.
I'm sorry, I'm having a little technical difficulty. Can you hear me?
Yep, you're good now.
Okay, thank you. And here's a resource at the bottom if anybody's interested, to strategies for making the return on investment case for behavioral health to managed care organizations and government agencies. It's local health to managed care located on the Open Minds Library, and you can certainly check that out. Even if you go into the search bar there and look for some of the information that we've written or some of the news that we've provided, you can search telehealth and all of that will come up. Some of the newest information is on there, some of the best resources, and it'll really help you make some decisions when you're looking to plan for better telehealth services. Okay, and then coming up on January 20th, you'll see that there is a new webinar, and it's going to be Ken Carr and Ray Wolf discussing performance management. So hopefully you will attend that. And then I'm going to turn it over now to Stacy to see if she has any questions from the attendees that she'd like to ask.
Thank you, Erin and Amanda. We do have a couple of questions that came through. One of the questions that was asked was, what have you set as success markers that you're tracking? You may not be able to share your specific statistics, but what are certain points that you're looking at to gauge whether these programs are impacting the outcome for the consumers that are involved?
So we track kept sessions, kept assessments. We track data to see if they engaged in their treatment recommendation within 2 weeks of their assessment. And then we track their, when they close, what they, if it was a successful closure, unsuccessful, we track data that way as well through our EHR, our electronic health record.
And then a follow-up question that was with that was the tracking that you're doing when it involves communicating with other partners about that data. Are you seeing any challenges there, knowing that all systems are not created equal?
I'm not sure I understand the question. Like other partners, like you mean like collateral like contacts outside of the agency, or do you mean like our board? So I think that we all kind of track the same things in behavioral health. We want to see how many people keep sessions. We want to see how many people engage in services, and we want to see what their success rates are. It's just how it's measured. So we do all of our measuring is done internally in our electronic health record, whereas some people still do it like with a pen and pencil and track things that way. So there's a different margin of error. I think the biggest thing that we've had to do internally is we've had to standardize our discharge definitions so that everyone was using them the same, so that our data wasn't getting skewed. So what does a successful completion look like? What does a therapeutic discharge look like? What does an ASA look like? So our agency-wide is using that, and it's not just left up to interpretation, if that makes sense.
Excellent. The other question that was posed was, what percentage of your staff is providing telehealth services? You said, obviously, not everyone is really made for that role, but what percentage are you able to see successfully trained in engaging your consumers?
So I would say probably 75 to 80% of our staff is comfortable and successful doing telehealth. We don't have at this time, but are moving towards having identified specific telehealth sessions, clinicians for that as its own line of business, but we're just not quite there yet. Right now, I think with the staffing shortages that everyone is feeling, with the COVID numbers being as high as they are and people being out, now's not the time to try to launch that, but when things level out, that's the plan. So,
and have you seen increased retention because they are able to provide a telehealth service and continue to feel that they're providing success to their consumers?
Absolutely, and I think that we've also been able to keep some of the people who would have needed to take FMLA due to their own medical conditions that would prevent them from being in contact with people on a consistent basis. We've been able to accommodate that by allowing them to work telehealth and allowing them to stay with our agency. Because a lot of people had to quit the field initially when COVID first hit.
Could you talk to any other benefits that you see from a staffing standpoint of being able to provide this service versus the traditional in-clinic only?
So something that we're piloting that's been extremely successful is we have been piloting a rotation in some of our offices where, irregardless, you don't have to be in quarantine anymore, but we are rotating people to work from home certain days a week on a rotating schedule to keep the number of people down that are in the office, A, but B, give people a break from being in that constant germ environment, for lack of better words, stranger danger, and to work from home, which people really see as a benefit. It doesn't cost your agency anything, and they feel like they're getting a bonus. We're able to track through our EHR how productive they are, though. So if they aren't productive, they lose the privilege. But so far, everyone has absolutely loved it. So 1 week they come in Monday, Wednesday, Friday, and the next week they come in Tuesday, Thursday, and we rotate it that way.
Excellent. And then one of the other questions that was posed was, do you have any new programs that you're looking to launch via the telehealth service virtual app opportunities that are existing right now in today's world?
I think we're going to start to look at, especially now again with COVID numbers going the way they are, we're going to start looking to use it more in our residential settings as well as our outpatient settings to accommodate family sessions, to accommodate, more contact with family while somebody's in treatment. We haven't been able to accept as many outside visitors as we would like in some of our programs just because of COVID restrictions and having to keep, things safe for the people at the program. So I think we're going to start expanding telehealth out more to our residential programs as well.
Are you doing that now? And I'm sorry, I had a technical difficulty for a couple minutes and I couldn't
That's okay.
hear anybody. So with visits, are you doing those in the residentials through telehealth?
We have done some of them. It's not always the case. We try to get people in when we can, but certain programs have outbreaks or things like that. We have been using telehealth. We also have fellowship programs where we have doctors who are training to get addiction certifications, and we've been able to use telehealth to have them observe groups and stuff without having to expose them potentially to COVID and going back to the hospital and taking that back to an entire system. So
That's an
would be really
amazing
terrible.
idea. Absolutely. And what
I don't want
about
to be the cause of a plague. So.
one of the things that is really important in substance use treatment is recovery support, peer support professionals. Are
Yep.
they using telehealth services as well to meet
Absolutely.
with people?
Yep. So we also use them with our CRSs. We use them with our, we have a tobacco cessation group that we have, a support group. So we use the telehealth to manage that as well. Then we're able to capture people from multiple offices into one group. And we're able to have facilitators like CRSs and things like that cover multiple sites that they may not be able to. So it's been extremely helpful.
Yeah, that was one of my questions. How do they provide it? Like, do they provide the services like from their home when they're meeting with folks, or just?
It just depends where they are that day. So like if they're in the office, they would provide it on telehealth from their office computer, but you can also provide them from home. That's the greatest thing about telehealth ever. If I happen to be in the office, but it's time for me to run a telehealth group, I can run my telehealth group from my desk. If I happen to, all my clients canceled that afternoon and I don't have a group till 7, I'm able to go home and run my group at 7 and not have to sit in the office twiddling my thumbs. So it's kind of cool. There's a lot of flexibility with it.
Yeah, there is.
And then one other question that was posed was, you talked about the training that you do for the staff, and that you do that on a regular basis to allow people to not only be trained if they're new staff, but if they just need retrained. You also talked about first appointments and helping people if they're struggling, but are there any documentations, any videos, anything that you provide in advance to the consumer to get them ready to start this program? As you said, many of them may be within that student realm where they're accustomed to Zoom, but I am sure there's a wide variety of people with a wide variety of skill sets.
So when they call in to make the appointment or when they speak to our call center, what we do is we screen them to see if they would prefer telehealth or in person. We give that option up front. If they choose telehealth, we tell them what platform we use. We ask them if they're familiar, and if not, we'll walk them through the process ahead of time. So it's not like you just automatically get telehealth, you get the option of either or. And then sometimes we have people the day of who are supposed to be coming in person who will call and be like, hey, I woke up, I have symptoms, I don't feel comfortable coming in. We're able to flip it over to Zoom with them for that day so they don't miss their session as well.
Excellent. Okay. I think that is all the questions that were submitted. Is there anything else that you feel that we didn't get a chance to talk on that's important that our audience kind of thinks about as they're approaching their telehealth expansions or how they're evaluating their services?
I don't know. I don't know why anyone wouldn't want it. It's such a great opportunity. I've been waiting for it for years to come to substance abuse. I'm a licensed clinical social worker. I've been using it in the mental health field forever. So it's really great to have it on both sides of the, on both sides of the fence. So it's the future. I mean, I think this is the way everything is,
Well,
And we talked about a lot of the details of how everything's going. So thank you so much, Amanda, for everything. You really put a lot of things in perspective.
You're welcome. Thanks for having me.
thank you both. I appreciate your time, your expertise, and I'd like to thank all of you that had the opportunity to listen to the program. As a reminder, this will be shared tomorrow on the Open Minds website, both the recording of this event as well as the presentation deck that Erin and Amanda went through. And we invite you to join us on Thursday, January 20th at 1 p.m. Eastern Time for the next Circle Elite Executive Roundtable with Performance Management, Timing is Everything, Acting Before It's Too Late, which will feature senior associates from Open Minds, Ken Carr and Raymond Wolf. They'll discuss metrics as well as strategies. And we invite you to join us every Thursday at 1 o'clock. Mark your calendars for special roundtable presentations throughout the year, as well as some additional virtual seminars that we will be offering during this time. Again, check out the Open Minds website for the recordings, as well as an amazing array of library resources on these topics and more. Have a wonderful afternoon.
Thank you.
Thank you.
Bye.